Good afternoon, everyone. I'm going to get started. Thank you so much for being here on our third annual Parkinson Symposium. And thank you to the Ridgefield Library for having us this year. We are record-breaking numbers, so this is very exciting. For those of you who don't know me, my name is Megan Labor. I'm the Parkinson Center Manager and Physical Therapist Assistant in our therapy center. I am LSVT BIG certified, so I treat a lot of patients with Parkinson's, and I was a care partner to a family member with Parkinson's disease for 7 years. So I'm a little biased, but one of the greatest parts of RVNAhealth services is our Parkinson Center. As Parkinson Center leaders, we saw an unmet need in the community for people with Parkinson's to create this center. And there's no better place to come with all of what RVNAhealth has to offer, including our interprofessional team for comprehensive care. So the components of the Parkinson Center consist of therapy, exercise classes, education and community programming, and our PD boot camp. So all of our therapists are LSVT Big and Loud certified. And when we talk about therapy, this is not just physical therapy, but occupational therapy and speech language pathology as well. We are all certified by the Parkinson's Foundation to treat people with Parkinson's. And we treat in-home and in our therapy center. In addition, we have exercise classes. We have Strength and Beyond with Andrea DeLange. We have Living Big with Chris Greco, Living Loud with Susan, and we have Dance for PD. We have 2 more classes, one of which is open to the public, and another one is for boot camp alumni, so that'll be fun to see everybody there. Look for a flyer outside. And we just started our Boxing and Beyond with Sarah Triano, so you should hit that up. We all know exercise is the #1 thing to slow the progression of the disease. As a supplement to therapy, we have these classes, or you can join when you are discharged from therapy. We also have educational lecture series, community programming, support groups. We have one support group that's open to people with Parkinson's and their care partners. It's for free. It's the last Wednesday of each month from 2 to 3 at RVNAhealth. We have social activities like cooking classes, and like I said, our upcoming Dance for PD Bootcamp alumni is coming up. Those are just a few examples, but keep an eye on our calendar. And one thing that we have that's very special is PD Bootcamp. This is designed for all people with Parkinson's to live their best life. And we take 10 participants. We do it twice a year, so our next cohort will be in the spring. So look out for dates for that. So just to go over a little bit today. So after I speak to introduce what's going on today, Andrea and I are going to do a short presentation on external cueing strategies, leveraging technology to improve Parkinson's mobility. It gives a little highlight to what our breakout session is in the other room for technology. And then Dr. Mayton will be speaking at 1:15 in this room, so we can just stay where we are. And at 2 o'clock will be our breakout sessions. So you will choose one of the following choices. You can A, stay in this room and hear Dr. Rachel Butler-Pagnotti speak, or you can come to the tech lab 1 door away with Andrea and myself, or you can go into the entry area in the hallway and speak with our information booths and sponsors. After that, we will come all back in here for Dr. Buckingham's keynote speaker at 2:45. And then we will have one more breakout session where you can choose to stay in here and hear from Dr. Salvadori, or come to our tech lab if you weren't able to on the first breakout session, or go to our informational booths in the hallway. And then at 4 o'clock, we will wrap it up. Throughout the symposium, we have refreshments in the back of the hall in the last table. There's coffee, waters, fruit salad cups, and Bobo's Energy Bites. It's very good. And if you need any help throughout the day, look for somebody with a purple lanyard or a green lanyard, and we'll be more than happy to help you. Restrooms are right outside this door, right across the hallway. And thank you to our sponsors for making this event possible, Liz and Stephen Goldstone, Medtronics, Abbott, and Avi, and of course our Ridgefield Library for hosting us and letting us use their wonderful space. So I just want to say that we're so grateful for all of you here, and we really appreciate them. If we couldn't do this without them. So please take some time and stop by their tables and to learn a little bit about what they do. But I'd like to give them the opportunity to give them a little, give their little elevator speech on what their companies do and why they're here. So let's hear from Medtronics, from Maddie and Madison. They're coming.
Yeah, no big deal. Thank you. Hi, everyone. Thank you, RVNA, for putting this symposium together and inviting us all to be able to share what we do as our companies.
So I'm Maddie, and this is Madison. We are your local Connecticut DBS representatives. So happy to have you all here, and once again, thank you to RVNA for putting this together. So we work on a daily basis with all of the local care teams, patients who are also dealing with Parkinson's on a daily basis. So one of our most exciting advancements that we just came out with is called Adaptive DBS, or ADBS. Now what that is in the past we've had stimulation, which is just constant stimulation throughout the day. Adaptive DBS allows for that therapy to go up and down and kind of adapt with you throughout the day. So that stimulation will listen to your brain signals and then adapt when you need more and then go down when you need less.
So come check us out at the table in between any of your sessions, and we'll give you more information about it as we are your local reps in Connecticut. Hope everyone has a great day today.
Thank you so much. I'd love to introduce Ashley from Abbott.
Hi, everyone. Thank you for joining us today for this event that RVNA has put together. I'm Ashley with Abbott, so I cover all of New England. So I do a lot of traveling, but I just took over Connecticut. So I guess the one thing about Abbott, if you want to learn more, is that we have virtual clinic, which means that once you get implanted, you can actually get programmed remotely, so you don't have to make the trip to the clinic. It's a very big time saver, especially for the patients and the doctors. And if you want to learn more, I'll be out here all day, but I hope you enjoy the event and all of the presentations you'll be hearing.
And lastly, I'd like to introduce Christy from Avi.
Good afternoon. Thank you all for coming, and thank you for inviting me to participate today. My name is Christy Klossner. I work for AbbVie, and I have Vyalev, which is device-based therapy. So it's a continuous infusion of levodopa, carbidopa over 24 hours. I have information at the booth for educational events, so please come join me in between the seminars today. Thank you.
Thank you to all of our sponsors. Okay.
Hi, everybody. I'm so happy that you're all here. I'm happy to be part of this symposium. And my name is Andrea DeLange. I'm a physical therapist, and I am the clinical lead of the RVNAhealth Parkinson Center. And today, Megan and I are presenting on, as she said, external cueing strategies, leveraging technology to improve your mobility. And this is kind of like a quick, overall overview so that when you get to the breakout session, you will understand why we're doing what we're doing. All right. So what we're going to cover is how Parkinson's affects the movement centers of the brain, what is an external cue and why is it good for you, what are types of external cueing. And if you want to know more, it's not that we don't want to take questions, but we want you to come to the lab. So come to the lab later. Okay, so Parkinson's disease and the brain. So most of you people probably already know this, but Parkinson's disease is a result of the loss of dopamine or dopamine receptors in the part of the brain called the basal ganglia. And what happens when we don't have enough dopamine is we get impairment in both our movement centers as well as our non-motor symptoms, which are our cognitive centers. So when we have impairment in movement, what we mean are those 4 cardinal signs of Parkinson's disease, which is slowness of movement. Maybe you feel some stiffness, you might have a tremor, and you might feel like your balance is off. And when we're talking about cognition, we're talking about memory, executive functioning, and maybe some emotional stuff like depression, anxiety, fatigue. So what happens is when your brain is lacking this dopamine, there's an imbalance between what we call motor control, which is a balance between, so motor control meaning how easy it is for me to move, is a balance between that our automatic or unconscious movement, right? Like when you get out of bed and go to walk, I don't know how much you think about it. Maybe if you have Parkinson's disease, you're thinking about it more, or maybe it's not as easy. But if you think about maybe when you were a kid, you learned how to ride a bike. Now you you don't forget how to ride a bike, or you go to brush your teeth. You don't need a tutorial every time you brush your teeth or you make a pot of coffee. It's sort of that automatic ability of your brain to do that. And so it's a balance between that and then the part of your brain that has to like plan it out, right? So the memory of how to do it, the executive functioning of if I'm making a pot of coffee, right? You're starting to think about, where's the pot? I got to fill it with water. Where's the coffee, right? So that kind of thing. So when you have someone who has Parkinson's disease, this balance is an issue, and you can get impaired movement. But so why this is important is that neuroplasticity, we all hear that crazy word, right? That's our brain's ability to build new neural pathways, right? Which is important. We get that from exercise. We know exercise and movement is important for 2 reasons. Number 1, exercise is important because it is the only disease-modifying treatment that we have right now. But also, so we need to exercise, but we also need to like live our lives and do the things we need to do. So wouldn't it be great if we had a way to bypass this circuitry? So this picture you see here is just sort of like the circuitry of how the brain works to create neuroplasticity and how it affects behavior, right? So if we could bypass the need to use the basal ganglia and use a different part of our brain, and which what Megan's going to talk about in a minute is goal-based exercise. So if we made an external cue, which Megan's going to go into in a second, of kind of bypassing that whole automaticity, wouldn't that be an awesome thing if we can do that? So here's Megan.
So let's start with the definition. What is an external cue? So an external cue is a verbal instruction or an environmental stimulus that directs a person's attention outward, focusing on the outcome or the effect of a movement in the surrounding environment, rather than one's internal sensation or specific muscle action. So for you care partners out there, this could be an example of why your loved one is not following through with an instruction of pick up your foot, walk bigger, walk faster, because that's more of an internal focus. So let's give examples of external focuses. So examples of goal-based exercise, instead of saying lift my leg to clear the ground, lift it higher, we can put a hurdle on the ground so that your brain has to realize that you have to step over the hurdle rather than trying to rely on that automaticity. And it's less of a cognitive load for your brain. So if you knock it over, you'll get immediate feedback that you didn't pick up your foot enough. So types of external cues that are visual could be, if you've been in therapy with us, we've used the blaze pods or colored dots on the floor, apps like Clock Yourself. We use the ladder for ladder drills. We use activator poles, and Strider glasses is something new that we have in our tech breakout lab that we're really excited to show you guys. Auditory cues include the Movive that we are going to have in our tech breakout session, so come see what that is, a metronome, and walking to a musical beat. And then you can have a combination of auditory and visual, so making it a game, the Wii, virtual reality, any addition of dual task practice. So why is this all how does it help people with Parkinson's? It helps use that other area of the brain, as Andrea was talking about. It puts things into more of a goal-based practice instead of so that you are learning a new skill, incorporating principles of neuroplasticity, and it's learning through feedback. So if you hit that hurdle down and you're not picking up your foot enough, you know that you need to pick it up higher to not hit the hurdle down. And I mean, this could be subjective. It's more fun. If it's fun, we learn more and we're engaged and we remember, our brain remembers it more. So it just is using other areas of the brain like the hippocampus. So in our technology lab today, we have the Movive demo. We're going to play games with Hawkeye and Clock Yourself. We're going to use blaze pods with dual tasking and obstacle courses, and we'll be using the Strider glasses and activator poles in a different obstacle course. So if you have questions, come see us in the breakout session.